Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. Imagine you've recently had a CT scan, MRI, or ultrasound. You've been waiting several days for answers. Then your phone buzzes. Your imaging results are now available. You open the report. You scroll through unfamiliar medical terms. Then suddenly you read something you weren't expecting. Incidental finding. Or maybe the report mentions a cyst, a nodule, a lesion, a calcification. Your heart starts racing. Wasn't my scan supposed to look at my knee? Why are they talking about my liver? Do I have cancer? For thousands of people every day, this moment creates fear, confusion, and countless internet searches. But here's something that may surprise you. Many incidental findings are not dangerous, and discovering them is actually a normal part of modern medical imaging. Today we'll explain what incidental findings are, why they happen, when they matter, and why finding something unexpected isn't always bad news. An incidental finding is exactly what it sounds like. It's something discovered during an imaging examination that wasn't the reason the test was ordered. For example, your doctor orders a CT scan to investigate kidney stones. While reviewing the images, the radiologist notices a small cyst on your liver. The cyst wasn't causing symptoms. Nobody suspected it was there, yet modern imaging revealed it. Or perhaps you're having an MRI because of persistent headaches. Instead of finding a serious problem, the radiologist notices mild sinus inflammation that wasn't related to your symptoms. That's also considered an incidental finding. These unexpected discoveries can happen with almost any imaging test, including CT, MRI, ultrasound, X-rays, mammography, and nuclear medicine examinations. The important thing to understand is that an incidental finding doesn't automatically mean something is wrong. It simply means your imaging examination revealed information beyond the original question your healthcare provider was trying to answer. Medical imaging has changed dramatically over the last few decades. Today's scanners can see details that were simply impossible to detect years ago. Modern CT scanners can create incredibly thin image slices through the body. MRI systems provide exceptional soft tissue detail. Ultrasound equipment produces higher resolution images than ever before. As technology improves, radiologists naturally see more. Imagine cleaning a window that was once covered in fog. Suddenly, details begin to appear everywhere. The landscape hasn't changed. Your ability to see it has? The same principle applies to medical imaging. As image quality improves, tiny cysts, small nodules, minor degenerative changes, and normal anatomical variations become easier to recognize. This creates an interesting challenge. Modern imaging answers the doctor's original question more accurately than ever before, but it also uncovers many findings that might never have been discovered otherwise. Some of those findings are important. Many are simply part of normal aging or harmless variations that have likely been present for years. Let's look at some of the most common incidental findings that radiologists encounter. Small kidney cysts are extremely common, especially as people get older. Many liver cysts are benign and never cause symptoms. Tiny lung nodules are frequently discovered during CT scans performed for completely unrelated reasons. Imaging of the spine often reveals mild arthritis or degenerative disc changes, even in people who aren't experiencing significant back pain. Small thyroid nodules may be seen on imaging of the neck. Sinus inflammation can appear on MRI scans performed for headaches. Doctors may also identify benign bone islands, small areas of dense bone that are a normal anatomical variant in many people. These findings can sound alarming because of the medical terminology used in a radiology report. Words like nodule, lesion, or mass often cause understandable anxiety. However, these terms are descriptive rather than diagnostic. For example, the word lesion simply refers to an area that looks different from the surrounding tissue. It does not by itself mean cancer. Similarly, a nodule is simply a small lump or rounded area seen on imaging. Many nodules are benign, but some require additional evaluation depending on their size, appearance, location, and the patient's individual risk factors. This is one reason it's so important to discuss imaging results with your healthcare provider rather than relying solely on the wording of the report. Not every incidental finding is treated the same way. Some are so common and have such classic imaging features that no further testing is needed. Others may simply be documented in the report so your healthcare team has a complete record. But occasionally, an incidental finding deserves a closer look. Perhaps the radiologist recommends another imaging study in 6 months. Maybe an ultrasound is suggested to better evaluate an area seen on a CT scan. Sometimes additional blood work or a referral to a specialist is recommended. That doesn't automatically mean something serious has been found. Often it simply means the radiologist wants to gather more information before drawing conclusions. Medicine is about reducing uncertainty whenever possible. Follow-up imaging is one of the safest and most effective ways to determine whether a finding is stable, changing, or requires treatment. In many cases, that follow-up confirms the finding is completely harmless. One question patients often ask is, if it probably isn't important, why mention it at all? The answer lies in the role of the radiologist. A radiologist's job isn't simply to answer one question. Their responsibility is to carefully evaluate everything that is visible within the examination. Imagine you're having a CT scan because of abdominal pain. While the scan is looking for appendicitis, it also captures parts of your liver, kidneys, spleen, pancreas, major blood vessels, lower lungs, bones, and other surrounding structures. If the radiologist notices something that could be medically relevant, it's their responsibility to describe it. That doesn't mean every finding is dangerous. It means every potentially important observation deserves careful documentation so your healthcare team has the complete picture. Think of the radiology report as a detailed map rather than a final diagnosis. The report provides observations. Your physician combines those observations with your symptoms, medical history, physical examination, laboratory results, and previous imaging to determine what they mean for you. This collaboration is what leads to informed medical decisions. Although incidental findings can cause understandable anxiety, they can also provide an unexpected opportunity. Some of the most important diagnoses in medicine begin as incidental findings. A tiny lung nodule discovered during a CT scan for kidney stones, an enlarged section of the aorta identified during imaging performed for back pain, a kidney mass noticed while investigating abdominal discomfort, or a thyroid nodule found during imaging of the neck after an injury. In some cases, these unexpected discoveries lead to earlier diagnosis and treatment than would have otherwise been possible. Early detection doesn't guarantee a particular outcome, but it can create opportunities for earlier evaluation and management. It's one of the reasons medical imaging has become such a powerful tool, not only for answering today's clinical question, but sometimes for identifying tomorrow's health concern before symptoms even develop. Modern medical imaging has become incredibly powerful. Today's scanners can reveal remarkable detail, helping healthcare providers diagnose disease earlier and more accurately than ever before. But with that power comes an important challenge. The more we can see, the more unexpected findings we discover. Some are clinically significant, many are not. Healthcare professionals constantly work to find the right balance. We don't want to overlook an important abnormality that could benefit from early treatment, but we also want to avoid unnecessary testing, procedures, and anxiety for findings that are unlikely to affect a person's health. This careful balance is one reason radiology is both a science and an art. It requires technical expertise, clinical judgment, experience, and thoughtful communication between radiologists, referring providers, and patients. Every imaging study tells a story. Sometimes it's the story your doctor expected, and sometimes it reveals a completely different chapter. Understanding that difference can help patients approach unexpected findings with knowledge instead of fear. If you've read your imaging report and noticed an incidental finding, the first and perhaps most important piece of advice is this: don't jump to conclusions. Radiology reports are written primarily as communication between healthcare professionals. They often contain technical language that can sound alarming when read without medical context. Instead, take a moment to understand what the report is actually saying. Did the radiologist describe the finding as benign, stable, or likely insignificant? Was follow-up recommended? Or did the report simply document an observation without suggesting any additional testing? These details matter. Your healthcare provider is in the best position to explain how the imaging findings fit with your symptoms, medical history, physical examination, laboratory results, and any previous imaging you've had. If you have questions, ask them. Some helpful questions include: what exactly was found? Is this related to the reason I had the scan? Do I need any follow-up? Is this something I should monitor in the future? Remember, imaging is only one piece of the puzzle. The picture becomes much clearer when all the pieces come together. Medical imaging has transformed healthcare. Every day, millions of examinations help answer important medical questions, guide treatment decisions, and provide reassurance to patients around the world. Sometimes those scans reveal exactly what your healthcare provider expected to find. And sometimes they reveal something completely unexpected. An incidental finding isn't automatically good news. It isn't automatically bad news either. It's simply information. Information that deserves careful interpretation. Information that may confirm everything is perfectly normal. Information that may lead to additional testing. Or, in some cases, information that helps detect disease earlier than anyone anticipated. Perhaps the most important lesson is this: finding something unexpected doesn't mean you should panic. It means you should ask questions, understand the context, and work with your healthcare team to decide what happens next. Modern imaging gives us remarkable insight into the human body. With that insight comes responsibility, not only for healthcare professionals who interpret the images, but also for patients who seek to understand them. Knowledge doesn't eliminate uncertainty, but it can replace fear with understanding. And sometimes, that's exactly what people need most.